Marc Miller says it's crucial to stay on top of the second wave as it makes its way into First Nations across the country.
We've seen recent outbreaks in remote and isolated communities and recent increases in cases that are both alarming and concerning. We must anticipate and prepare for more in the coming weeks and months.
And you can say Miller's putting his money where his mouth is. Wednesday, Indigenous Services announced $1.2 billion in extra funding for Indigenous communities, over $600 million for public medical health responses, and nearly $400 million for community support,
so that they can tailor their own responses. And it's been wildly successful in ensuring that communities can actually implement, for example, perimeter security, for example, their own on-the-land initiatives.
Miller also announced $180 million for long-term care facilities. In the press conference, Indigenous Services says they would like to have Indigenous communities in the territories fully vaccinated by the end of March. But following incidences of systemic racism, like the treatment of Joyce Echaquan in a hospital in Joliet, Quebec, Miller acknowledges that some may be skeptical to the healthcare system and getting vaccinated.
What we've seen in some communities is really good uptake, starting with the elders. And when people see their elders getting vaccinated, they say to themselves, well, I'm a 25-year-old, and if my grandmother can do it, I can do it.
Prime Minister Justin Trudeau wants the entire population of Canada vaccinated by September. But Indigenous Services say they don't have a specific target date. They continue to prioritize northern remote communities, but southern First Nations have options.
Pfizer is obviously an option for closer communities. I think it's an option that's been offered to Six Nations, offered to Akwesasne, among others, because of the closer proximities.
Jamie Pashigumskum, APTN National News, Ottawa.